This conference will now be recorded.
And for this presentation, Melissa Mateen will be presenting to you today on this topic. She is a health educator with the Florida Department of Health here in Miami-Dade County and is a part of the Community Health Action Team, also known as the CHAT team. I will now turn it over to Melissa. Thank you so much.
Candace, I just want to confirm you can see my screen. I think when you began recording, it exited my sharing. So I want to make sure you see my screen.
Yes, we do.
Okay, perfect. Thank you. Hello, everyone. My name is Melissa Mason. I am with the Florida Department of Health in Miami-Dade County. I work for the Office of Community Health and Planning as a health educator. And like Candace said, today we're going to talk about cholesterol basics. We're going to review how it can affect your health, some risk factors, and how to improve your cholesterol levels. So before we get started, I want to go over these basic questions with you. I'm going to ask you to refrain from answering them. We will return to them at the end of the presentation, but maybe you can keep them, in your mind and answer them as we go along. So I'm going to read them off to you, and again, please hold off on answering them. So they are all true or false questions, and number one is high cholesterol is a risk factor for heart disease. 2. Cholesterol cannot obstruct blood flow. 3. Consuming saturated fat lowers your cholesterol levels. 4. Dietary cholesterol comes from the food you eat. And finally, total cholesterol should be less than 200. So what is cholesterol? Cholesterol is a waxy, fat-like substance that is found in every cell in our body. The body does need cholesterol to perform important tasks such as forming cell membranes, making hormones, making vitamin D, and helping digestion. So our body does need it. You can think of cholesterol as coming from two sources. You have blood cholesterol, which is the type that circulates in your blood. In the body, specifically the liver, makes all that you need. Then there's dietary cholesterol. This is the cholesterol that comes from the food that we eat. It's found in animal products such as meat, seafood, poultry, eggs, and dairy. So since the body makes all the cholesterol that we need, if we add too much from the food we eat, so dietary cholesterol, we can increase the risk of heart disease. It's recommended that people eat as little dietary cholesterol as possible while on a healthy eating plan. So if you look at the picture below, it's a really good graphic to show you how cholesterol accumulates in your arteries. So as cholesterol or plaque builds up in the arteries, you can see how it begins to narrow and blocking the flow of blood. So as these plaques build up, eventually they can shut down your coronary arteries that feed the heart, and that is what may result in a heart attack. So there are two types of cholesterol. Cholesterol is carried through blood by protein packages called lipoproteins, and there are two types. There's LDL, or low density lipoprotein, which pastes cholesterol on artery walls, similar to how we saw in the picture. And this restricts the flow of blood. High levels of LDL are unhealthy and can contribute to heart disease, and that's why it's known as the bad cholesterol. Then HDL, or your high density lipoprotein, carry cholesterol away from the cells and return it to the liver. The liver then flushes it out of your body. So these high levels of HDL are good for your body and protect you from heart disease. A good way to remember LDL and HDL is thinking of the word lousy and happy. So LDL, L for lousy, and HDL, H for happy. So bad and good. Mm-hmm. So who should be tested? So unfortunately, cholesterol doesn't really have signs or symptoms. So the only way we really know what our levels are is to have a blood test. Adults should have a cholesterol test every 4 to 6 years, except for people who are at high risk. They should be tested more often, and you should work with your healthcare provider to really know when you should be taking them. Children and adolescents should have at least one cholesterol test between the ages of 9 and 11, and again between 17 and 21. So testing your cholesterol levels requires a blood draw and may also require fasting. A cholesterol test, also can be called the lipoprotein profile, will measure your total cholesterol, your LDL cholesterol, and your HDL cholesterol, and your triglyceride levels. So just to make sure, I wanted to touch a little bit on that. So your triglycerides are a type of fat in your blood that your body uses for energy, and having high levels may indicate an increased risk for heart disease. So the following chart shows you the desirable cholesterol and triglyceride levels that you want to aim for. So total cholesterol, you want it to be less than 200. Your LDL, lousy or bad cholesterol, you want it to be less than 100. HDL, your good cholesterol, you want 60 or higher. And your triglyceride levels, you want them to be less than 150. So just like many other chronic diseases, there are controllable and uncontrollable risk factors. So let's start off with the risk factors that you can control. So family history. So if you have a family member with high cholesterol, it increases your risk for developing it yourself. Your age, your chances of developing high cholesterol increases as you get older. And your sex. Young women have a lower risk for high cholesterol than young men. However, at about 45 to 55 years old, a woman's cholesterol rises to a level equal to or greater than of a man of the same age. But of course, there's also controllable risk factors that we can address to lower our risk. But some of the things that put us at risk is having a diet that is high in saturated or trans fat. So cholesterol, because it's found naturally in foods derived from animals, such as meat, eggs, and cheese, diets that are high in saturated and trans fats can increase your blood cholesterol levels. Having an inactive lifestyle can make you gain weight, contributing to high cholesterol. Excess weight and obesity raises levels of LDL or bad cholesterol. It affects how our body uses cholesterol and our ability to remove that LDL cholesterol from the blood, raising your risk for heart disease and stroke. Smoking. So tobacco smoke can damage blood vessels and it hardens our arteries, making them more likely to collect plaque. High blood pressure. It forces our heart to work harder, adding stress on the walls of the veins and arteries. And type 2 diabetes. It affects the walls and veins of the arteries and the way the body uses sugars and fats in the blood. Diabetes often leads to high triglyceride levels and LDL cholesterol, as well as low HDL cholesterol levels. So lifestyle changes are the first steps that you can take to lower cholesterol levels and to reduce the risk of heart attack and stroke. So first, we're going to talk about eating healthy. So some key recommendations include reducing your saturated and trans fats in your diet, reducing sodium and added sugars, choosing foods high in fiber. So you can think of oatmeal, citrus fruits, beans, and peas. Choosing unsaturated fats. So these are your healthy fats, such as avocado, olive oil, and nuts. And overall, you want to choose fruits, vegetables, whole grains, lean meats, and low-fat or fat-free dairy products. A good resource is choosemyplate.gov. The USDA developed MyPlate to make your selection of appropriate foods easier. You can visit the website and click on the selected tabs to access many great resources, including Start Simple with MyPlate, which offers tips and ideas. You can get a MyPlate plan, which is personalized based on your age, sex, height, and weight, and physical activity level. There are other resources too, such as great infographics and videos, recipes, food safety basics. And finally, you can browse by audience. So different languages, but also target populations. So they have a whole section on children too. So another important lifestyle change to help lower cholesterol is to get regular physical activity. So physical activity can help maintain a healthy weight, lower cholesterol and blood pressure. The recommendation for adults is 2.5 hours of moderate intensity activity. This can be broken down to 30 minutes 5 times a week. If you don't have 30 minutes at a time, you can even break this down further to 15 minutes in the morning or in the afternoon, as long as you add up to 2.5 hours in a week. Some tips are to try a brisk walk or a bike ride, but really finding an activity that you enjoy so that you can stay motivated and stick to it. The next tip is to reach and maintain a healthy weight. This will help you lower LDL cholesterol levels and triglyceride levels. It increases your HDL cholesterol levels, lowers your blood pressure, improves your ability to use blood sugar, prevent diabetes or control diabetes if you already have diabetes, and talk to your doctor about what a healthy weight is for you. He might go off your BMI, which is your height and your weight, but also your sex and your age. So really talk to your doctor about what a healthy weight looks like for you. So quitting smoking is also important. As we know, smoking damages your artery walls and your blood vessels. So quitting will really reduce your risk of high cholesterol and heart disease. You want to limit alcohol. So too much alcohol can really increase your cholesterol and your triglyceride levels. Men should have no more than 2 drinks per day, and women should have no more than 1 drink per day. So if you need help quitting smoking, the Florida Department of Health Quit Your Way program provides free and evidence-based tools and services. You can access tools like a 2-week starter kit of nicotine replacement patches, text to quit, email tips, and quit guide. You can choose as many as you need or use them in addition to phone group and web quit services, which have already helped 234,000 Floridians. So if you can visit tobaccofreeflorida.com, or you can call 1-877-YOU-CAN-NOW. So although all these lifestyle recommendations are wonderful and they can really make a difference in your cholesterol, some people may need to take medication to lower their cholesterol levels. Cholesterol lowering medications work best though when combined with lifestyle changes. So we always encourage those as well. So we're going to get back to the questions that I asked at the beginning. And please feel free to chime in the chat box with true or false with whatever you think, okay? So high cholesterol is a risk factor for heart disease. True or false? So that is true. Like we mentioned earlier, the plaque buildup can eventually block your arteries, leading to a heart attack. So cholesterol cannot obstruct blood flow. True or false? False. Yes. So it's related to the first one. Cholesterol can obstruct blood flow, which increases your risk for heart disease. Number 3, consuming saturated fat lowers your cholesterol levels. That is false. So we want to consume unsaturated fat. Number 4, dietary cholesterol comes from the food you eat. True. So you can think of the 2 sources. You have blood cholesterol, which your liver makes, and then dietary cholesterol, which comes from the food we eat, specifically animal products. And your total cholesterol should be less than 200. And that is true. So here's some resources that you can access for more information about cholesterol. You can always go to the CDC, the NIH. For more information about eating healthy, I mentioned choosemyplate.gov. And of course, if you need help quitting tobacco, you can visit tobaccofreeflorida.com. So are there any questions? I think, Candace, this is your part.
Thank you so much, Melissa, for that great presentation and learning about cholesterol and the importance of it. I am now going to turn it over to Robert and Bree, as you all have submitted some questions beforehand, but you also have the opportunity now to put in the chat box any questions you guys have from the presentation today.
Great, thank you, Candace. And thank you, Melissa, for that great presentation. So I'm gonna get started with the questions here. Our first question is, how can I control cholesterol with diets?
Okay, sure. So let me go back to this slide. So going back to this slide, really making healthy choices is key. To go over these healthy messages again, you want to really reduce that saturated and trans fat. So with saturated fats, you're thinking butter, lard, palm oil, coconut oil. You want to replace that with olive oil, canola oils, avocados, really reducing sodium, which is not only going to help with cholesterol, it'll help with many other things. Reading that food label is very important. Choosing the no salt added or the lowest sodium you can find. Added sugars. You know, recently there were changes made to the food labels. So now if you look at the back, you'll be able to see the added sugars. And that's really what we want to avoid. You want to choose foods that are high in fiber. So like the slide says, oatmeal, beans, and peas. Unsaturated fats, again, avocado, olive oils, and you really want to choose lean meats if you eat protein, animal protein. So skinless chicken or turkey, lean beef, pork, lamb, and fish, as opposed to processed or fatty meats. You know, if you had the choice between egg whites or egg yolks, always go for the egg whites. For healthy snacks, you're thinking walnuts or almonds instead of potato chips. And yeah, and again, you can always visit choosemyplate.gov for more information.
Thank you, Melissa.
No problem.
Now, our second question is this: is cholesterol specifically linked to any diseases?
Sure. So in this presentation, we talked about the link between cholesterol and heart disease. However, as we talked about risk factors, we know that if you have high blood pressure and if you have diabetes, it also puts you at a risk for high cholesterol, but really heart disease, because as you see the picture right now, you can see how that plaque will build up and block your arteries, putting your at risk for heart disease and also stroke.
Our third user submitted question is this: could you just share some tips to help lower cholesterol and recommend foods to eat and not eat to help lower cholesterol? I know you already touched on this a little bit. I was just wondering if you could elaborate.
Sure. So again, going back to foods to eat and not to eat, I know I touched on the protein, but replacing fat, whole fat dairy products, so like cream, cheese, and ice cream, really replacing that with fat-free or low-fat milk and cheese. I know they also sell cheese that is low-fat. Healthy snacks, walnuts and almonds. What you really want to pay attention to is also serving size. Always reading what the serving size is and making sure you're sticking to that, the appropriate portions. If you want to have a smoothie in the morning, you can make that. There are a lot of recipes out there, always making sure that you're not adding sugar to that. Adding oatmeal to it if you are using it as a meal. So there are many ideas out there. I'm not sure if that answers the question.
It does. Thank you. Our next question is this: I eat healthy, work out, but my cholesterol is higher than I would like. The good cholesterol level is very good, but the bad cholesterol is too high. Is this something?
Hello, Robert? You cut off, I'm sorry. You cut off, and is this something, and I couldn't.
Oh, I'm sorry about that.
It's okay.
I'll re-ask the question. I eat healthy, work out, but my cholesterol is higher than I would like. The good cholesterol level is very good, but the bad cholesterol is too high. Is this something to be concerned about?
So unfortunately, yes, there's There are things that even with physical activity and eating healthy, like that person mentioned that they live a healthy lifestyle, but their bad cholesterol is still high. I would definitely talk to my healthcare provider about that to see what I can aim for. Maybe you can work with a nutritionist, or maybe he has specific tips for you, or ultimately he may decide that you need to go on a medication. But because it's very specific to the person, I think reaching out to your healthcare provider is probably the best. Although I will say that, of course, lifestyle choices and living a healthy lifestyle always helps. But yeah.
Very good advice. Thank you. Now, our fifth question is this. What is atorvastatin? I don't know if I said that right. aka Lipitor. What is that used for?
Sure. So I meant to mention that Myra Garcia, who is a community health nursing supervisor, is also on this call, and she can help answer that question. Myra?
Hello, can everyone hear me?
Yes.
So atorvastatin, or better known as Lipitor, it's really the chemical name for one of the most popular statins, which is a class of medication that helps to lower LDL in the body and can raise HDL, the good cholesterol, a little bit, and it also tends to lower the triglycerides too. So it has a triple effect. And it's really one of the first line of medications that a doctor would put a patient on if, despite lifestyle changes or attempts to modify unhealthy behaviors through healthy eating and physical activity or not smoking, if the patient is still having elevated levels above 240 for total cholesterol, or a high bad cholesterol, the LDL, or high triglycerides, this is going to be one of the first types of medications that they would put a client on. And you really need to work with your doctor, because you don't want to just take the medication and stop doing all the good work that you've tried to do to modify your cholesterol through a healthy lifestyle. You do definitely want to continue, as Melissa was saying, you want to optimize the need for medication, but once you are on medication, you really need to work with your doctor and take it as directed. It is important to take the way the doctor prescribes it, and not do any kind of modifications on your own in attempts to, change your diet. You really need to work with your doctor once you're on medication. And these medications are not a cure for high cholesterol. They really will need to be continued until perhaps maybe the level comes down, or there's this significant weight loss perhaps that maybe does bring the number down to a desired level. So it's definitely working with your healthcare provider once you're on these medications, but statin is just one of the more common ones.
Thank you, Myra and Melissa. Now we have another user submitted question. If someone eats 2 eggs every day, can that increase his or her cholesterol level?
So again, it would really depend on the person, like what their lifestyle looks like, if they are overweight or not, if they live a healthy lifestyle in terms of being physically active, if they already have high cholesterol. So because it's so specific, I would defer from recommendations. But again, if you're someone who's looking to reduce your cholesterol, you can make better choices. So instead of having 2 eggs with 2 egg yolks, you can have 1 egg yolk, or just have the egg whites. But because it's such a specific question, we're lacking that personal information, you can always ask your doctor and check what your cholesterol levels are, and you can go from there. Myra, I'm not sure if you have anything to add.
No, I would just say, I think in case it's not clear, the egg yolk is the part of the egg that contains cholesterol, but it is a healthy cholesterol. However, anything that's good is sometimes in excess not good. So that's the whole issue with eggs. Egg whites are certainly a better, healthier alternative, but the egg yolk does contain the healthy form of cholesterol. So really, again, as Melissa suggested, that I would work with my physician to see if eating 2 eggs every day is having an effect on my cholesterol level. And if I'm on cholesterol management modification through medicine and lifestyle, probably cutting back the quantity of eggs. So instead of 2 eggs, 1 egg, or maybe just a couple of eggs a week. So definitely working with the healthcare provider and possibly a nutritionist to address that.
Thank you again, Myra and Melissa. At this point, I'm going to turn it over to Brianna for more questions. Brianna, are you there? Looks like we may be having some technical difficulties. I'm going to go ahead and ask some more questions, okay? Give me 1 second. All right, so our next question, are there any alternatives to statins? And the second part of this question, the effect of statins on memory and links to dementia, if you could touch on that a little bit.
Myra, would you like to take that one?
Sure. I'll jump in on that one. So really with this high cholesterol situation, as Melissa was explaining, the goal, of course, is to have optimal heart function. So anything that prevents that from happening, whether it's high cholesterol, high blood pressure, high blood sugar, all these things are risks that increase the chance of having a heart attack. But the heart and the brain are definitely, you know, all systems in our bodies are connected. So there has been a strong link between the heart and the brain in the body. So the heart-brain connection is what it's referred to, and anything that helps the heart is going to help the brain. So Alzheimer's, dementias, anything related to the dementias, which of Alzheimer's is makes up half of the dementias, is going to help. So the studies are, you know, it's hard to do studies like these, of course, but the suggestion is that yes, that anything that helps the heart, so lowering your cholesterol and controlling it, along with controlling hypertension, along with controlling high blood sugar, is going to help the brain in the long run, and any associated chronic diseases such as the dementias and the Alzheimer disease.
Perfect. Thank you, Myra and Melissa. Our next question, can cholesterol be lowered without drugs? So if you have it, is it just hereditary?
So we spoke a little bit about lifestyle changes, which are the first step in helping lower your cholesterol. As to whether you can do it without drugs, it'll depend. Again, as we touched based on medications, some people will need medications to help lower their cholesterol, and we always encourage those lifestyle changes because they will help your cholesterol medication work better. So it will really depend on you as a person. Some people are able to lower their cholesterol without medications, some people aren't. So it will depend on the person.
Melissa, I can also add, there are some kind of homespun supplement that people sometimes tout as helping to lower cholesterol, and certain of these are just natural. For example, garlic and fiber. We've already touched on the fiber, but the important thing with all of these things is to not take any kind of natural supplements or any supplements or things you buy online, for example, or from out of the United States even, that tout claim to lower cholesterol without checking with your doctor. Some of these, for example, garlic, if you incorporate garlic into your cooking, that's perfectly fine. But once you start having these supplements that really are not controlled by the FDA, their claims are really not founded, and they can really harm you more than they can, help you in some cases. For example, garlic can thin your blood. So you wouldn't want to take a high dose garlic supplement before surgery. Or you may be on a blood thinner already. For example, someone who's had a heart attack in the past may be on something called Coumadin or warfarin. And those blood thinning medications combined with a high dose of garlic, for example, can cause potentially life-threatening bleeding. So it's very important to not take any kind of supplements that contain anything that claim to do something that is not FDA authorized and based on studies. So always check with your physician before taking anything or using recommendations that friends on Facebook or social media tout. And there's a couple of other ones too, but for example, ginger, turmeric, and rosemary, I would say those are fine to use in the natural form, but be careful before you take a supplement that's a high dose of any of these things. It's better to use the dietary approach. If you're still at a level that your doctor's encouraging you to eat healthy, really go with the fiber, foods that are high in fiber, for example, fruits and vegetables, and all the high whole grain products. Citrus fruits are very good for lowering LDL, nuts, soybeans, and healthy omega-3 food sources. We really haven't touched on that, but the heart and the brain love heart healthy and brain healthy omega-3s and omega-6s. Omega-3s, for example, are even anti-inflammatory in the body, so they help with other conditions as well, but definitely for the health of the arteries. So those would be things that are like fatty fish, like salmon, mackerel, herring, tuna, sardines. So all those fish that feel very oily, those are actually very good for your heart and for lowering triglycerides and lowering cholesterol in general. Seeds like flax seeds, chia seeds, and walnuts, Melissa mentioned earlier. Again, those are great sources of omega-3s, and they can easily be added to salads, used as a snack, for example, walnuts. You can add them to your smoothies in the morning. Chia seeds added to yogurt is a great way to start the morning. So yes, there are definitely natural ways and alternatives to medication, but definitely work with your physician.
Great advice. Thank you, Myra and Melissa. And now I'm seeing we have 2 more user-submitted questions. The first question, does the time you take your cholesterol medication make a difference?
Sure, this is Myra. Medications are meant to be taken at certain times and meant to be taken consistently. So if your doctor recommends that you take, for example, the statins at nighttime, that I would stick with that routine, and any deviation from that, you should always discuss with your doctor. Taking medications within a few hours of the time you normally take them is probably okay, but some people find that that working with the doctor will lead to better results if you discuss these things with your doctor and come up with a plan that works for you and your lifestyle and your schedule, because they can definitely have an effect if you don't take them as prescribed and as recommended.
Great, thank you. Now our last question here, can you offer any healthy snack ideas or any meal prep ideas for breakfast, lunch, and dinner? I know you've been touching on these, food topics. I don't know if you have any on that.
Sure, I'll chime in. So Myra mentioned a very good idea for breakfast, especially on the go. You have healthy smoothies. Think about adding a lot of fiber in there. You can put in some walnuts, like she mentioned, spinach if you like green smoothies, really watching out for that sugar intake. Of course, for lunch, you can think about meal prepping, maybe a salad with a lean piece of protein. If you're not vegetarian, if you're vegetarian, you can make it a vegetable salad. Brown rice, quinoa, really the whole grains is what you're aiming for. For snacks, whether it's a handful of nuts or a yogurt, making sure that it's low fat or fat free. If you prefer a warm breakfast, you can think about oatmeal, adding fruit to the oatmeal. If you prefer adding things, really sticking to the natural forms of sugar. Yeah.
All right, thank you again. Those are some great answers to all those questions. I'm not seeing we have any more user submitted questions in the chat box. So at this point, I'm going to turn it back over to Candace.
Thank you so much, Robert, and thank you so much, Melissa, for this presentation and for a great Q&A session. You received a lot of comments in the chat box. Wonderful job. And at this time, I would just like to share with everybody on this webinar, as a reminder, with our Healthy Happens Here series, we will be putting on another webinar in October, so please stay tuned for that. And lastly, I would like to invite you, if you haven't already joined, but we do have a webinar this Friday, October 2nd from 10 a.m. to 11:30 a.m. We will be presenting the Health Equity in 2020, What Does This Mean and Why Does It Matter in the Age of COVID-19 webinar. And for this, we will have two presenters, one from the University of South Florida and the other from the Montefiore Health System's Office of Community and Population Health, and they'll be speaking about COVID-19 and many of these disparities that exist in leadership in this. And so we will go ahead and provide this webinar link in the chat box if you would like to register. At this time, if there's no other questions, we will definitely end this webinar now. Thank you all so much for joining us and have a wonderful day.
Thank you.
Thank you so much.